AB 411 is a bill that will allow the public to actually see what is going on in our Medi-Cal system in terms of health disparities. The bill asks that the department analyze quality data that we're already collecting in our Medi-Cal system, the level of quality we have in Medi-Cal and the Medi-Cal plans, and then also analyze it by demographic data. So we want to look at geography, ethnicity, language spoken at home, sexual orientation, other factors. And why is this so important? Because we want to assure that all Californians in the program are getting equal treatment. And if they're not, that we can identify them and work to address that. So we want to know if there are different people, let's say, living in an urban area versus a rural area. Are they getting the same quality of care? Are people of different ethnicities getting the same quality of care? Are people of differing sexual orientation, are they getting the same quality of care? And if they're not, then we need to address that. Now, we actually know from research that the answer probably is that they are not getting the same quality of care, but it is important that as a state, we collect the data to measure and then monitor and then make efforts to address that. And AB 1208 is also a very important bill because right now, while we do collect the data on ethnicity and geography and so forth, we're not currently collecting data on sexual orientation and gender identity.
For over 12 years, I've worked to improve the quality of healthcare for communities of color and for people who do not speak English well. And it's time Medi-Cal prioritized addressing health disparities. Over 7.5 million people are in Medi-Cal currently, and an overwhelming majority of them are from communities of color. 43% speak a language other than English. In addition, approximately 1 million individuals from communities of color will be newly eligible for Medi-Cal thanks to the ACA beginning January 2014. However, the Department of Healthcare Services and Medi-Cal managed care plans do not have a systematic way of identifying health disparities among their members. Yet we know that communities of color experience poorer health outcomes, often for conditions that are preventable.
You can't fix what you don't know. And this data is crucial to collect and to analyze so that we can make the improvements in our healthcare systems for all Californians.
I'm here today as an elected school board member, a health advocate, and a member of the LGBT community to ask Governor Brown to sign these important bills. The diverse community I serve and represent will benefit from Dr. Pan's bills, and we all recognize the need for more data when it comes to healthcare in LGBT communities. In particular, we believe that LGBT patients are at increased risk of HIV/AIDS, certain cancers, and have special mental health care needs. These findings were published 5 years ago in the American Journal of Public Health, yet we are still not collecting this data on whether or not these issues are being addressed.
We know from various studies that health disparities impacting lesbian, gay, bisexual, and transgender people are real, but we cannot work to address those disparities effectively until we begin collecting this data. This legislation will help California better understand the challenges that our community faces.
We are here today, again, to urge the governor to sign AB 411 and sign AB 1208 so that we will have the data we need, that Californians need, to ensure that our public programs are meeting the needs of all Californians and that all Californians will have the promise of equal treatment and equal access to health care in the state of California.